Obstructive sleep apnea has long-term consequences, and the main consequence is neurobehavioral. In children, there is some excessive daytime sleepiness, but it's not as pronounced as in adults. But learning problems, problems with behavior, and problems like that actually imitates attention deficit hyperactivity disorder, not the disorder itself, and also problems with aggression and peer problems. So those are the main long-term consequences, and some studies show that even with treatment, some of these consequences do not return back to normal. So children, despite the treatment, continue to have problems with behavior and neurocognition. So that's one of the main indications for treatment. So if you diagnose obstructive sleep apnea in a child, even if it's mild, if the child is experiencing symptoms with attention and neurocognition, then the treatment decision should be made. In addition to that, especially in younger children, there's a problem with growth. They grow poorly, and after treatment, their growth improves. And also, enuresis, that's nocturnal enuresis, is secondary, is another problem associated with sleep disordered breathing. And we know from treatment trials that once the disorder is treated, enuresis improves. So that's another treatment option, treatment indication for children with obstructive sleep apnea. The gold standard of diagnosing obstructive sleep apnea in children is video-assisted in-laboratory polysomnography. And this technique is very cumbersome, and it requires for the child to come into the laboratory and sleep with a lot of tapes on his body. And there may be some children who may not cooperate, but even if they cooperate, then there's a long waiting list because these laboratories are not a lot in number, and there's a long waiting list for the children. And also polysomnography, although it shows a lot of physiological parameters such as the number of apneas, hypopneas, either obstructive or central. If the child has arousals, which may be associated with impaired sleep quality, they may not correlate with the outcomes. So they don't predict if the child has improvement in quality of life after the treatment, or if the cognition will improve after the treatment. So there are some drawbacks about the overnight polysomnography that's made in the hospital, in the laboratory. One of the best tools that can be used in children is home polysomnography. Home polygraphy is a limited amount of information that we can get. Maybe we can get a flow and chest and abdominal belts, and also pulse oximetry. So the problem with that is it's usually used in adults very successfully, and there are a lot of studies from children as well. But the problem is that because it's so limited and there's no video equipment usually at home, and also there's no technician, that it may be unsuccessful. But now there are a lot of studies showing that it may be feasible even in younger children. So if it is used in good hands, if people who are used to it, home polygraphy is a very good option. Another option is using pulse oximetry overnight and analyzing it, how many DSATs the child has, how often they are, how severe the desaturations are, and they may actually predict the children who have very severe disease or who have complications after surgery. And it can be used, the overnight pulse oximetry, in resource-limited settings to prioritize children who needs the treatment the most. So if the child has very severe desaturations overnight and has symptoms of obstructive sleep apnea, and this child needs to be prioritized for the treatment, not to waiting for a long time to get a polysomnography. And we also use some techniques such as maybe sleep endoscopy to diagnose, but this is more to decide which sort of treatment that child needs. You can also use some questionnaires. Pediatric sleep questionnaire has been validated against polysomnography, has a pretty good sensitivity and specificity. However, it may not be perfect for an individual child, but it's good for epidemiological studies, and also in resource-limited settings, it can be used in conjunction with the physical examination findings, and also questions about the morbidity of the obstructive sleep apnea. So those are the resources that we can use. And lately, Sleep Clinical Record from Italy, that was developed by Maria Villa Pia and her co-workers, is another tool that has been studied recently in children.